Dear Dr. Gardner, how do I know if I may be at risk for endometrial cancer? What are the most common risk factors for the disease? Endometrial cancer is the most common gynecologic tract cancer in this country. And actually, we're seeing the incidence as being on the rise. There are some family histories that may be helpful to be aware of. Specifically, if you have a family history for endometrial or uterine cancer, ovarian cancer, or colorectal cancer. There's a genetic risk factor called Lynch syndrome, which some families carry, whereby there's a substantially increased risk for uterine, ovarian, and colorectal cancers. And in that situation, patients can be diagnosed with endometrial cancer even at younger ages. So it's important to be aware of your family history, ask questions, perhaps see a geneticist, to get testing and see if you carry a genetic risk factor for endometrial cancer. There's other risk factors for endometrial cancer. Some patients that have polycystic ovarian disease or diabetes, it's increasingly recognized that there are some metabolic changes in our body chemistry that can serve as the backdrop for the development of endometrial cancer. This is not to say that every patient that has polycystic ovary, PCOS, is going to develop endometrial cancer, but it's more about having an awareness. And if there are some of these potential risk factors for the disease, to be speaking with your gynecologist, your primary provider, and definitely if there's any abnormal change in bleeding pattern, something that's different for you, to consider asking for an endometrial biopsy or further investigation.